We're again doing a Facebook Live. As you folks know, Dr. Malone is a board-certified internal medicine physician. He was a hospitalist at Baptist Hospital here locally for how many years, Doc?
I guess I'd have to, if I had to guess, 5 years.
5 years.
And lost track, yeah.
Yeah. A hospitalist, if you were still a hospitalist, what kind of stuff would you be doing in the hospital like today?
They're considered necessary and I guess mandatory personnel. So I'd be going to the hospital and carrying out normal shifts. I haven't spoken with any of my former colleagues at all, but I imagine that there's probably some precautions as far as, where do you stay when you're not at work? You don't want to take anything home to the family. So I don't know if some of these people are staying at other residences or not seeing their families for a period of time, but I can only imagine it's quite a sacrifice.
But a hospitalist is the doctor that stays in the hospital and rounds on the patients that are in the hospital. So in a normal situation, normal times, you're the doctor that's there, in 12-hour shifts or 10-hour shifts in the hospital at all times, checking on the patients. And, the attending physician may be a different kind of doctor, like a neurologist or neurosurgeon or orthopedic surgeon or other type of doctor that maybe has done surgery on the patient, and they go home after they're done seeing their patients in their office or at the hospital, and then they basically leave you in the care of a hospitalist. And so a hospitalist, like every other internal medicine physician and family practice doctor, I guess some of them are family practice doctors, have a pretty good wealth of knowledge about a bunch of different types of medicine. Is that fair to say? And but don't specialize in any one area of medicine. Is that pretty accurate?
Yeah, and we've talked about this before, where they're the quarterback, so they need to know when to call for help. They need to know when to call an audible. They need to know when something doesn't add up and it's time to go a different direction. And many times they're brought in as a consultant for the care of like a post-operative patient to help figure out a post-operative complication or some sort of decompensation.
Right. And so we've been basically having you look at what's come out every day on this virus, and us from a local standpoint, we've asked you basically to help us interpret, if you will, the data so that we can help ourselves and our families do the right things, make the right choices. So what has happened in the last 24 hours that we should be paying attention to, in your opinion?
Well, I guess I'll start with some of the numbers, as I've been doing that every day. So the numbers today are updated. Locally in Escambia County, a week ago, we were at 28 cases diagnosed, and here we are a week later at 113. So that's quite a jump, I guess. The numbers tested is about the same as well. So that is, still 8.5% positivity rate. The thing that was a little bit concerning was that the social distance scoring that we referred to a couple of nights ago, the most recent grade on that went to a D-.
Wait a minute. When we were a C,
and it went down to a D-. Yeah, and there's no interpretation at all provided on that grade. However, I guess my take on it is this a factor of people knowing that we were going to go under an order from the governor, and they traveled more in preparation for that? Meaning,
and how do they get this? They do it with cell
phone data,
pings on the towers.
Yeah, so cell phone data, and it's based compared to a baseline activity level for a geographic region of where people's homes are and how much they leave the home in a normal day when we're not under these conditions. And now they compare that to what these people are doing, how far they're traveling from home, how frequently they're leaving the home. And it's not like they know when you left. This is like population wide. So there was a dip in the grade. And again, I would like to think that it was because people are in preparation for, hey, we got 30 days of stay-at-home orders. So going to the store and stocking up, getting their prescriptions filled, things like that. So hopefully
that's not encouraging. What I'm worried about is that that's not a weekend either. This is during the week. So I would think that people would be more tempted to go do social things on the weekends, which means our D- could be an F by Monday.
Yeah, well, I'll track it and I'll report back then and let you know.
How often I'm only laughing because it's so serious. I wish how often do they grade that?
They're grading it every day. It's about a day lag though. So they don't, this grade, this D- isn't like right now today. This is like the data that they compiled as of yesterday. So it's about a day's lag. So that's why I was thinking like maybe 2 days ago, people were getting ready for being under stay-at-home orders. So we'll find out come Monday, and that'll really give us an idea how the weekend went. As far as, I guess, interesting or useful medical information, there was, I guess, a question that came in speaking with some folks that were tuning in to the Facebook feed yesterday about to-go food, to-go orders, and, is it safe? Is that something that you would advise? And I found a pretty good resource, which we'll share tonight afterwards, as we've been doing here, from UAB. And I'll say this again, UAB's got a fantastic website that, again, I would recommend people go and look into. We'll link it and you can go to the other aspects of it. But compared to some of these other ones that really are difficult to process, there's some really good infographics. And so the one that is on there about food safety and ordering food for pickup and to go, basically the CDC has said that the risk of transmission from the food itself, from the packaging and all that, is very low. But they still say that you need to practice the social distancing guidelines when you go to pick up your food, when you have your food delivered. And that means trying to pay without cash, trying to pay online, trying to pay over the phone when you call, any of those kind of things if it's offered. And then washing your hands before and after you've gotten that package in and out of your home. So bring a cardboard box into the house, set it down, wash your hands really good, and then plate your food, eat, and then when you take the box back out to the garbage, wash your hands again. So that's they're saying they're encouraging that so long as you practice the social distancing guidelines. So that's just something I would pay attention to. Most of the restaurants and vendors locally, we've at the house here, we've ordered from them, have been doing that, and they make it very easy. And as we mentioned before, it feels good to support the local community as best we can. So we're trying to alternate nights here. And I haven't seen or experienced anything that would make me scared to order food from any of these places. So we'll share that information. Hopefully that answers the question from last night. The other thing I wanted to talk about, and I find this interesting, was thermometers. So at the office, I guess during our last week of being in the office, as you had mentioned, we were checking our temperatures, multiple times a day for each employee, right? And
That was 4 weeks ago.
Yeah, yeah, oh yeah, and we flagged a couple of people that were 99 point whatever, and at that time we're like, they're probably not the best people to be in the office, and so they more or less were sent home, not as a punishment, but as a let's keep everybody safe. And so it's interesting to see that now these digital thermometers that hook up to your cell phone and have apps. Caveat being that not everybody has these, so that the thermometer we're using at the office wasn't feeding our data to this database, but this company that has now harvested this data is showing where we are, where we expected to be, and where we are. And we'll share that link. But do you want me to share the screen of it real quick, or?
Yeah, I think I know what you're talking about. What this company is doing is that they know what typical temperatures this time of the year are for that general area. And so regular flu temperatures, regular hay fever temperatures, they have sort of a baseline, a number wise. And yeah, and Florida, for whatever reason, last week it was even worse than that. But last week, Florida was all red, except for the Panhandle was orange, and which indicates not only that they're high temperatures, but they're higher than last year this time, and the year prior to that, when you would expect people to have a certain number of people to have temperatures from unrelated COVID sources. So I think that's the takeaway from this, I believe, is that Florida continues to be the highest state that has atypical, look, that's how they say it, atypical high fevers.
And well, in this graph here, that's what you're seeing, that little red blip down at the bottom of the screen, if you're able to see that. But now we're dipping underneath what they had expected, and they're associating that with social distancing. So take that for what you will. As far
which would be helping not only COVID but flu. So they would not even have the same temperatures that people had last year, because if you're not around somebody that can catch the flu, you're
Yeah.
you're not going to have any temperature.
Yeah, and this graph, it's clear to say that it's influenza-like illness. So they're not saying that these are cases of this COVID virus. So it's anything that's a febrile illness. I'm interested because this, there's going to come a time where basically all thermometers feed to data, and then you're capturing the population. Now we're just capturing people that have these thermometers. So there's been studies, and I looked this up, and just for historical purposes. Uh, as far back as like 2006 or 8, where they're doing these things with similar type devices, and it was with influenza. And at the time they said data from smart thermometers accurately track real-time influenza activity at a state level. Local surveillance efforts may be improved by incorporating such information. Such data may be useful for long-term local forecasts. And that was almost a decade ago.
Wow.
So I think this is going to push that data and that technology forward.
Yeah, that
I really
company's
do
loving
think it's useful.
That company's loving this right now.
Oh yeah.
They're
Oh yeah.
free press over this. Yep.
Yeah.
Well, good for them though. They invested in the technology and they had a good idea, and they deserve this bump. All right. So what about us in Pensacola? I mean, I heard the mayor's son. I heard this, and the mayor's son actually had some kind of diagnosis. I'm not sure if that's accurate or not, but
the news report is he had a positive test, and so appropriately so, any of the known direct contacts are doing what they need to, is quarantining, and that includes the mayor. So I guess he'll come up with ways to conduct his official business just under quarantine, and then basically it's a 2-week quarantine, and he'll have to monitor symptoms, and obviously comply with any outcomes from that, and God willing, not infected. But if he is, obviously, hope for the best.
Right.
So,
and what are the numbers in Pensacola again? Are they over 1,000?
So we've tested 1,300 people in Escambia County. The positive numbers are 113, which is 8.5%, and that's the test sites that are reporting to the CDC that compiles this data.
Last week or 2 weeks ago, we were talking about this, and it was when people were talking about the number of ICU beds. What were the number of ICU beds in Pensacola?
So it's the only data we have is for Escambia County.
Okay.
So the ICU beds in Escambia County were published at 106. And that was with knowing that there was a little bit of room for error if the PACU beds, the pre-op, post-op areas could be converted for ICU use if needed. And then the next question
that includes those, or that excludes
no,
those?
That does not include those. So you could then add on top of that 106 the extra beds that you could make available if you needed to. I have no idea what I would hazard a guess, but you go to a PACU area, you see maybe 10 beds in there. Maybe they could make that into a 5-bed ICU, because it's not a 1-to-1 switch. There's a lot more equipment that's required in space.
Is anybody reporting to us locally how many ICU beds are being used for COVID patients right now, or available?
It's not been reported, and I think that's some of it has to do with, I guess, the privacy, and the press releases that I've seen come out don't indicate that we're at capacity or anything like that. Not yet, but I haven't heard any overflow situations or things where they're in extremis.
I haven't had time to watch the local press conferences. I frankly couldn't tell you when they even have them, but I know they've been having them because I've seen references to them. Are they talking about when it is that Pensacola is going to reach its peak in cases yet? Is that even something that's being discussed?
I don't think it is on a local level. It's more referring to the state level, and the state's talking about basically the early part of May, like first week of May, as far as the peak.
Well, we wouldn't be on the same timetable as Orlando and Miami. We'd be, I think, 2 weeks or around 2 weeks maybe behind them. I mean, I would think, don't you think? I mean, if Orlando's going to peak next week, for instance, which is not, but if Orlando peaks April the 20th, I think we'd be into May in the Panhandle. But I mean, you got the Louisiana influence, and so we are closer to New Orleans than we are Orlando. So I want to know, when New Orleans is going to peak. It's almost more relevant to know when they're going to peak versus when Orlando is going to peak.
Yeah, you're right, and I think I might have that data. I can pull it up while we're discussing here. But go ahead.
I guess my thinking on it is, look, folks, I know nobody wants to stay locked up, okay? But if you knew that the most likely peak time was going to be 2 weeks from now, then maybe
April 12th is Louisiana.
Okay, so let's say ours is 5 days or a week behind New Orleans. So then that puts us April the 20th as a peak, potentially. Of course, this is no scientific modeling on my part. This is me just guessing based on what Louisiana has. And you think to yourself, all right, I can't stay in indefinitely, because that's how I feel right now. I'm like, how long are we going to be inside? Like, what is going on here? And so, but if you know that, well, it's supposed to peak in late April, at least you have an idea that on the backside of that peak, things are going to start normalizing slowly, right? On the backside of that peak. And that's the hope. And by that time, your hope is that they also have a rapid test that's available and people can do in their house on their own, that, that they can render those results. But seems like that's something that needs to be discussed more and needs to be publicized more. And I don't know if there's a way for us to figure that out and to some certainty, but I would think it'd be a combination of how quickly neighboring bigger cities are proposed to peak.
Well, so I guess to your point, which is very valid, is geography-wise, we in Pensacola or Escambia County are closer to Mississippi and Louisiana. Louisiana is predicted to peak April 12th. Mississippi is April 24th. And then again, going back to Florida.
What about Alabama?
I can pull that up real quick. Florida as a state is like May 5th. Alabama is April 19th. So if you want to group us into that group of 3 states, for our Escambia County, maybe we're going to be at the end of April and we're not going to be the May 6th or 7th.
Look, I don't think we fall into any categories when you talk about the peninsula of Florida, to be honest with you. I feel like we're more in line with Alabama, Mississippi, Louisiana in regards to most everything, but good or bad or indifferent. But when it comes to this kind of thing, where really geography makes a difference, and they're sticking out into the Gulf in the Atlantic, down the peninsula, 8 hours away from us, pretty much 7 to 8 hours away. Meanwhile, New Orleans is the same latitude, pretty well, little lower latitude, but it's certainly the Mississippi Gulf Coast is the same latitude as us, and a lot of Louisiana is the same latitude as us, and Birmingham's just or Alabama's just so much up, and Mobile, of course, is right there. So I would think we should be paying more attention to those April peak dates for Alabama and Mississippi and Louisiana than Orlando, Miami.
Yeah, I think you're right. I think that's valid. So I'll pay attention to those dates as we get into further videos here as we track through May. And I'll
all right. Yesterday, I couldn't think of that word droplet. I didn't mean to interrupt, but that word droplet is the word I kicked myself last night. Like, droplet. I heard it 4,000 times on TV. I couldn't think of it. But droplets and aerosols. Those two terms have me a little crazy right now, because I mean, they're talking about how aerosols can last, in the air for a while. And if you don't have coverage, you can walk right into like this fog of COVID and suck it into your nose or your mouth. And all of a sudden you're sick now. And then these droplets that they come out in bigger form when you're coughing or sneezing. Right. But, I think it sounds like the move is towards people wearing some type of covering. I won't even say mask anymore, because I think that's a loaded thing now, because you can't wear a mask outside the hospital, because then you're potentially depriving the hospital workers. And that's the last thing anybody wants to do of PPE. So, scarf, some kind of, like that thing you were talking about that people wear around their necks.
Like a buff when you're on a boat or
right.
you're outdoors
Correct.
on the beach.
Correct. you know, maybe we should be talking about that next time. Maybe we should talk how to properly wear one of those. And you know,
Yeah.
once you pull it up and you're walking around in public and you want to put it down, I mean, you pick it back up again, you're contaminating your hands at that point. So then you got to wash your hands somewhere before you touch your face, because now you get contaminated this buff thing. So it's almost like if you're going to go out somewhere and pull it up, don't pull it up. It stays up. You take it down, you take it off. And then when you're taking it off around your neck, you got to wonder, all right, am I going to contaminate now my nose and my face?
You got to go like pull it up and out and into the laundry.
I don't know. Maybe a scarf is better, where you just wrap it and then you can unwrap it. I don't know. But us wearing scarves around here in April at this time of year is not exactly ideal either, I don't think. No. All right. So from a physician standpoint, what are you doing this weekend?
Not a whole lot. Doing some work some tasks that we got, firm related stuff, but besides that, not a whole lot. I'll try to cook dinner at the house. Got some yard work to do since we had some tornadic activity this week. All the yard work got reversed.
Okay.
That's it.
What if there's people watching this that are planning their weekend? They're going back to Fort McRae. They're going to tie up again and have a boat party out there at Fort McRae. What would you say to them?
I think, you know what, I saw that the Florida Wildlife Commission closed the waterways.
Oh, well, that's probably good.
Yeah. But if people want to do that, apart from whether or not it's actually closed, I would say that's a poor decision. I mean, I think it's poor and it's selfish, and it defeats why we're doing all this.
Right.
Why we're doing all this. Apart from, you know, the potential of making yourself sick or any of your loved ones, community, and I guess nationally, it's not helping. So I would say, you know, check it up for the weekend. We're fortunate enough to live in a place where you can go to the beach or out on a boat many other months out of the year once we pass through this. Our summer extends until October. So let's get through this thing and then do it. But I do think I saw a mention that the Florida Wildlife Commission was instituting fines of $500 or even jail time if people were out on boats. I didn't see that. So yeah, I'll see if I can link that.
We need to link that too, because I need to actually pay attention to that too.
Yeah. Let me get that linked up, and I'll send that and I'll share it so we can put it in the post here when we're done with this.
I also wanted, you know, people don't know this about you, but you're a 20-time Ironman finisher and Ironman triathlon finisher. And so talk to people about how important it is to, you know, everybody's cooped up in their house. You know how it is. If we go a day without exercise, we start feeling a dip in our hormones, and it starts affecting our mood and our behavior and our relationships. And even if you're not a 20-time Ironman triathlete, what is all this being cooped up? What does it do to your psyche? And what do you propose for people as far as making sure they get their exercise in? Runners.
We've been going out and running. I mean, we normally swim at a pool, which is now closed until May 6th. So there's no swimming at the local pool. So we've been running an extra day a week than we normally would be. We've been partaking in indoor bike riding on a trainer and trying to get some fresh air. My wife has been doing some, like cross training or CrossFit kind of workouts in the yard, just to try and substitute for some of the other exercises she does. And, we got a dog here that, the dog keeps you fit if you run around with it or take it out for a walk. But I think it's important to get some fresh air and to maintain some. You're going to go crazy indoors.
What I was thinking today, it's almost like you're in jail in a way, like you've been locked up. And you know what they do in jail, right? They work out and they all get all buff, and well, a lot of things happen in jail, but I'm talking about the stuff that's non-criminal. But you're cooped up in your house. You may as well eat right, because you can't really eat out. You shouldn't eat out that much because there's a lot of drama involved with it. I mean, I want the businesses to be helped too, but a lot of your meals are probably going to be cooked at home because it's not convenient to be going out to every meal. Not everything's open the same hours. They don't have the same menus. So you're going to end up eating better. So you may as well use this time wisely. You're home. You're not having to go to work. So you don't have an excuse. Oh, I don't have time to work out tonight because I had to work late. You're saving 40 minutes driving back and forth to work, most people. So use this time to get, like, I think productively, not only to keep yourself from getting the virus, but get your health better. Like, make yourself healthier. Eat more vegetables. Work out. Work out a little longer than you typically would work out. You don't have a boss that's looking for you to be at the work at 8:30, right, staff? And so and making sure you stay till 5:30. Like you're cutting corners at the house. Every boss knows they're not getting the productivity out of their people that they were getting when they were here, which might have been 60%. I don't know if there's any study about this, but I guarantee you there may be a curve that goes like this. As soon as they get home, they may work a little bit for the first couple of days because they're so excited about being able to work at home. And then it's like, I guarantee the productivity goes down. But what I'm saying is we may as well use this time wisely, right? And so get yourself in shape, work out, put in some time for your meditation, prayer, whatever it is you do to keep your mind straight. And I don't know, improve yourself during this time. Don't just think about how awful it would be if you got the virus, which is what the news wants you to basically do. And, in a lot of ways, the news is helpful because it needs to scare you a little bit. But at the end of the day, you control your destiny on this situation. And let's make the best of it is what I guess I'm trying to suggest here. What do you think about that, Doc?
Well, I think that we're all out of our routine, and that's also not healthy. So establishing a new routine with a lot of the elements that you'd mentioned is, come up with a new routine so that you have a normal sleep-wake cycle, that you have a normal activity cycle that is the new normal for the time being, and try to maintain that. And if you're sleeping different lengths of hours or time, if you're eating different times of the day, then everything's out of sync. So try to come up with a routine, and I think that right there goes a long way, even for someone who is not either able to work out or not used to working out. Because we're not suggesting someone go out and try to run 10 miles for the first time tomorrow. It's a little bit of time, just like anything else. So get fit and take the opportunity to say, hey, I'm going to go walk around the block, and then realize, okay, I'm going to try and walk around 2 blocks. And before you know it, you're running a mile. So do that.
But I guess my point is, when you're working for somebody, you're not really controlling your schedule. They're controlling your schedule. And when you're working from home, you have a lot more control over your schedule. And you don't have to wake up and get ready for an hour. You don't have to drive there and drive back. You don't have to go somewhere at lunch and go back. You've got about 3 or 4 hours of time that you otherwise would not have. So use that 2 or 3 hours wisely and make yourself healthier is all I'm suggesting. I think it's good.
Yeah, we've been cooking breakfast at the house here and getting a morning workout. And
instead of Krispy Kreme every morning like you typically do, right?
Yeah, exactly. Yeah, on the way into the office.
Hardee's biscuits.
Yeah, but no, and so we do that, and I still have like an hour before it's time to report.
There's nothing wrong, by the way, with Hardee's biscuits every once in a while, and nothing wrong with Krispy Kreme either every once in a while. So I'm not knocking that stuff because I like those things. All right, so
let me interject 2 things, Joe. So the FWC they went along with the executive order where they're actually going to enforce the social distancing, unlike the stories we heard, I guess, a week ago now. So they have, now that the executive order is out, they have some backing. So I don't imagine that they'll be hesitant to cite people if there's any friction. But the waterways, they're not closed. They're just going to be enforcing it to the point where they could close it if people abuse it.
All right,
and I sent that link over.
So basically they're saying you got to be 6 feet away from another boat. I don't really understand.
It's more than that. So the boat distance is, let's see here, 50 feet apart, no more than 10 people on a boat. And then and that's just being on the boat, but the beaches are closed, the islands are closed. So
I know that.
So mooring your boat up and then walking to shore, that right there, that's disobeying the order. And
yeah.
So that right
I think people were tying their boats up offshore swimming
Yeah.
around their boats and, you know, going from boat to boat. That's the harder, that's the harder thing to do. And, you know, this may be fun in games right now, but if we go from 1,000 cases to Miami's at 5,000, I think, to 5,000 cases next week, because we have D- grade on social distancing or physical distancing, whatever you want to call it, then, you know, I guess we'll just be on the news, the national news. Oh, Pensacola got D- and an F, and their cases went from 100 to 4,000 over the weekend. And there'll be pictures of the boat up down at Fort McRae. I hope that's not the case.
Yep. So the other news alert I got since we've been on here is Mayor Robinson tested negative. But he's reportedly still self-isolating. That was the PNJ alert I just got. So that's good news that he's negative, and it's better news that he's going to continue to self-isolate in the event that the test didn't catch it because it was, you know, too early or what have you. So,
all right. Last Friday, we had this policy where we're not going to do another one until Monday unless something significant happens. I think we're going to do the same thing. If something significant develops and we feel like it might be of public interest to hear it from a doctor, of course, nobody wants to hear me talk on this subject, at least. Maybe any subject, but this subject for sure. And if I feel like it's important, or you feel like it's important for anybody that's watching this to hear from a physician, then we may come back on. But if it's a weekend like last weekend and nothing really developed over the weekend, then we'll probably just see everybody back on Monday. But appreciate you tuning in. Again, I'll remind people the office is functioning. We're functioning remotely. We're still doing intakes. We had intakes today. Car wreck. There are a lot less car wrecks going on, thankfully. But we did get a couple in today, and we're handling those just remotely. I've got a hearing on Monday morning, actually, that's going to go forward in a medical malpractice case in Santa Rosa County. And it's we're doing it all virtually by video. And the judge told us it's the first Zoom video conference, virtual conference he has done, I think. So I hope it goes off without a hitch, hopefully. So we are preparing for that this weekend, but we're always taking calls 24/7 for new cases. If you want to find us on the web, you can find us at zarzaurlaw.com. 855-HIRE-JOE is the vanity number. You can get us locally at our local number 2, which is 444-9299. Info at Zarzaur Law for questions to Dr. Malone and myself. And you can, of course, ask questions under the Facebook post. Other than that, we will see you guys Monday unless something comes up. Y'all stay healthy and get fit. Thank you, Dr. Malone.